Welcome back. Now, let's get started. So, we go through introduction. So, um, from time immemorial, it is an important thing to try and understand the relationship between where people are and their health. So, this has been of great interest to so many people across different parts of the world, and it continues to be a of great importance. That gives back to the study of determining the factors and distribution of health related states. Determining factor of health and distribution of health related states, which means epidemiology. What causes, what are the factors that predispose people to certain ailment, and what is the distribution of this ailment across society? And it has never been more important than ever, more important than ever than now, where we're going through this COVID-19 pandemic. So, studying geography and understanding how it plays a role in health has never been more important. And we can see how it becomes important across different areas, from public health to medical informatics to health geography. Uh, we can put all of it together as medical geography. Medical informatics have to do with exactly using the information from medical data and turning it into useful medical data into useful information, or how the information is processed and. But aside from that, let's now go to the specific and try and understand where GIS comes into place. GIS system, I specifically put systems here, SYS here, so that you understand that there is GIS science, there is GIS studies, and there is GIS system. So we are focusing on talking of the system now. So we can refer to this as a computer-based system for collection, processing, integration, visualization, as well as outputting, storing, analysis of spatially referenced data. So the key there is that it's a normal information management system. However, it has the capability of analyzing and processing spatially referenced data. That is one of the unique things about geographical information system, the ability to handle spatially referenced data. If we now extend that to health GIS, it's a GIS system that is able to handle or manage or process spatially referenced health data. So specific now, the underlying concept there is health data. So GIS databases, if we look at their structure generally, they are usually made up of two different segments. We have the spatial and non-spatial data. So the spatial data has to do with the understanding the spatially referenced part, is linking the data to location. And the non-spatial could be attributes, it could be characteristics. For example, if you take the number of people in a place, in a certain local government or a certain ward, and you now record what's the proportion of people within that ward who are with disabilities or with certain ailments, malaria, tuberculosis, and so on. The average age of different groups, the age dynamics, or the age distribution, and so on. All those are attributes and characteristics. That is the non-spatial data. When this is attached to a particular location, maybe a ward, maybe a local government, maybe a village, maybe a city, a town, and so on. When we put the two together, we can start developing a GIS database. So, These create a unique opportunity and possibility for us to now process the data and create new understanding. And the understanding and the insight that can be brought, that can emerge from this is only limited by our imagination and creativity. Therefore, there is a lot to do about how we understand and how innovative we are with the data that is in our hand. Because with the spatial combined with the non-spatial data set, it becomes really um, extensive. The possibility of answering questions, querying the data to bring out new insight becomes really extended. So, for example, we can assess illness and healthcare services to be able to now understand how do we link services to where the illness are prominent, and also start thinking of prevention. We can begin to understand the relationship between environmental factors and diseases. We can begin to assess population and their well-being. There's so many things we can begin to do, but it starts with the human aspect of the GIS system, the component, the software, the hardware, the techniques, the data, and so on. The most important component in the GIS system is the human element, because that is the linchpin. That is the part of the component that develops every other thing. So without that, the whole system cannot hold up. So in health, GIS offers the opportunity for improvements of quality, quantity of epidemiological research, healthcare delivery, accessibility, healthcare outcomes, and so on and so forth. So GIS provide a great opportunity to improve so many aspects of human existence when we are talking about health related studies, because there is more data, there is more possibilities to generate new insights. That is why a lot of research are moving beyond just observing and telling us this is what is there. We're now moving to the era whereby we use our understanding of what is there to now make and create new plans that can support better decision making and better action. So, if we want to look at application of GIS in health related studies, we can look at it from four different perspectives. Now, I want to sound a note here that this is not all exhaustive. It's just a broad categorization that can help us to start understanding areas of application. I'm sure with more reading, you might come up with some other ones that I've not been able to identify or I may not have come across. So we have disease surveillance, health risk assessment or analysis, healthcare access and planning, community health profiling. So I'll go through each one of these one by one so that we'll begin to appreciate what is possible. So let's look at health disease surveillance. This has to do with compiling and tracking of data on incidence, prevalence, and spread of diseases. So the idea here is that we need to constantly monitor what is going on in terms of disease incidences, and this is so important right now in terms of COVID-19, whereby we need to understand how the disease is moving across population and across places so that we can understand how we can address or mitigate its spread. So, main component therefore in disease surveillance has to be the mapping and the modeling. So, knowing where and predicting where it's likely to be or how it has been moving within the population and over space and in time. So the general idea, therefore, is to understand the where of the disease and therefore make decision about how can we check the disease, how can we limit the spread of the illness. We have the issue of the monkeypox, the Zika virus, the so many other emergent and diseases in recent times. We have seen how important this issue, this aspect of disease surveillance has been, whereby we're trying to understand how the disease is evolving across the population. So there are some examples across Nigeria as well, and that's why I've showcased the one from the NCDC, where they have a line of communication with all the health providers. The health providers feed into the local government feed into the states, and the state feed forward to the NCDC. So these allow regular reporting, and this provide a database for NCDC to be able to carry out appropriate analysis, and they also feed forward this information, this data set, to the WHO. So I have some links of some examples there. You can always explore that. This is where you have this is just a screenshot of the website from NCDC, and I can assure you, you'll be surprised the amount of data that is available there. So I enjoy you to explore that. The other aspect is the health risk analysis, whereby you're trying to examine the exposure of people to environmental hazard or risk factors, and then use that to create an understanding of the potential health outcome based on this exposure. So it includes assessment, management, communication, and monitoring of health impact. So the goal here is health impact compared to the previous one, the disease surveillance, whereby we're trying to monitor what is going on in the environment, across the population, to know the evolution of the disease and thereby use that to limit the spread of the disease. Here we want to look at the risk that people are exposed to and use that to model what is likely to be the health outcome. So we have a number of examples. There's one of my work whereby I look at the population at risk based on exposure to particulate matter, 2.5 to be specific. And there's another work, very interesting piece of work, a very recent one, whereby Ijumulana et al. 2020 looked at the potential health risk of fluoride concentration in groundwater in northern Tanzania. I enjoy you to read this work. It's an interesting one. There's a work that I and Dr. Shayomi is currently under review. We submitted it. This work started very early during the emergence of COVID-19, and still currently under review. So these are all examples of looking at the potential risk, health risk analysis, understanding how exposure could lead to particular health outcome for people. So these are is another very important aspect of health geography, with applications from, or with tools and techniques from GIS, so geospatial analysis. So I will take a short break here, and I'll join you again shortly.